Wow. Miss Latoya Green, can diabetes really lead to foot amputation? What signs should I look for early on? The two most common causes of amputations in the lower extremities is poor circulation and neuropathy, of which diabetics have a higher incidence of having circulation problems and obviously neuropathy. Poor circulation, what are the signs to look for? Cramps in the legs, legs are cold or cool, or they feel cold or cool to you. Decreased hair, you have less hair on your legs, on your toes. Weakness, not able to get up and walk as far as long as you want to. Those are all could be signs of a circulation problem, as well as swelling, discoloration. If you see your legs have gotten darker over the years, you have more swelling in your legs or your ankles. And then you have a wound that's just slow to heal. When we hit our shins on the coffee table, we have a little nickel cut. It's been 2, 3 weeks and it still hasn't healed up yet. Those all could be signs of circulation problems. Why is circulation a concern? Because you need blood to heal, the absence of which can lead to gangrene, that can lead to infections, or it can lead to an ulceration or a wound not healing. So yes, poor circulation is number one. We also call it peripheral arterial disease, or PAD. In addition, neuropathy is something that's a lot more complicated. Neuropathy is a decreased sensation in your extremities. A good example is you don't know you have neuropathy. You don't know that one day your level of sensation is diminished. How would you know you have neuropathy? You may have some symptoms. You may have some burning, some tingling, some numbness. You may have a itch underneath the skin that you just can't get to. Like, man, my foot just itches, and it's a deep inside the foot. Those are all signs of neuropathy.
And they can have any of those or all of those.
All of them. That's correct.
Mm-hmm.
Some people have their pain worse at nighttime versus the daytime. So they're in the bed, they're trying to go to sleep, but they cannot get comfortable because of that sensation in their feet. Another example that I tell about neuropathy is you and your friend, let's say I'm diabetic and the Collier is not. We're downtown going to the Hawks game. I misstep off a sidewalk. I break a bone in my foot, but I don't feel the break. I mean, the bone's cracked, but instead of me saying, oh my gosh, someone called 911, take me to Grady, I'm going to go home because I think I sprained my foot. I take a bucket, I soak it, I put ice on it. 2, 3 days may go by. Now my foot's more swollen. Now it begins to hurt more. That's when I realized, man, maybe I did more damage than I thought I did. So diabetics are at a higher risk for losing body parts because one, they don't identify that there's a problem. That's because they can have, a piece of glass,
Nail or
nail
can.
in their foot and literally not feel it. So that piece of glass can be in there for a few days. And because your skin is your first line of defense, once that skin becomes compromised, there's a chance for an infection. So the signs to look for is, again, make sure that you have, go see a podiatrist, number one. We do a very complete examination of your circulation system. We also can use ultrasound techniques to look at the blood flow in the entire, from the thigh all the way down, to check for any occlusions or blockages in the extremities. Neuropathy, there is no great test for neuropathy. It's more of a good clinician can tell if someone is neuropathic, but the data says that if you've been diabetic for more than 5 years, you have some form of neuropathy. So I just advise my patients, do not go on pain. By the time you feel it, it may be too late.
Or don't feel it.
Yeah.
And that's the key thing. You don't feel. There's a filament test where they actually basically, and that's the problem with this test. You can't measure. You just touch it and say, can you feel this, or you can't feel that? Does it feel different in this foot than that foot? As you move up the foot from the toes to the distal portion, the further away from the heart you are, the more disease you will have. And so you just say, does it feel different on this part of your foot near the toes versus closer to your ankle? And it's just a question and answer thing, and that can vary even on a day-to-day basis with the same patient. So that's why it's difficult to measure benefit of treatment, and it's difficult to make the diagnosis until something bad happens, like a person steps on a piece of glass, or they walking around with a pin in their foot since they were sewing or something, and it's been there for weeks or months and they didn't even know it because it took a while before it became infected. Your body's immune system does a great job in protecting you, but eventually it will break down if you have a foreign body in that area. Okay, Latoya, great question.